Hello, this is a presentation titled Assessing Patient Satisfaction with Dermatology Implementation During the COVID-19 Pandemic. The authors' names and affiliations are on the screen. I am presenting this student paper on behalf of the first author who unfortunately was not able to present this study. So in today's presentation, we'll talk about the history of teledermatology and the current status quo. We'll also talk about the methods we used in this study and the results and discussion towards the end. So historically speaking, teledermatology has been one of the prominent telehealth applications in healthcare. It dates back to a few decades. However, as a result of the COVID-19 pandemic, the field of teledermatology expanded multiple folds compared to in the past. As a result, patient demand increased for virtual care or telemedicine, especially during the initial phase of the pandemic when some healthcare systems in the US specifically shut down their in-person and in-clinic appointments. And so the only alternative available was to do telehealth. Teledermatology, by definition, is the remote delivery of dermatological services using telecommunications like telephone and video technologies. In the past, the literature have shown that teledermatology can improve wait times and can also increase the reachability of dermatology into underserved populations and populations in rural areas. It also have shown to be cost effective as it saves money and time in transportation back and forth to the clinic. In a study showed that more than 70% of dermatologists worldwide plan to continue using teledermatology moving forward even after the pandemic. However, it is unknown what is the patient experience with teledermatology, specifically during the COVID-19 pandemic. And therefore, it is important for us to realize that provider adoption is key. However, patient adoption and satisfaction is another driver to the success of teledermatology. So the objective of the study was to assess patient experiences using teledermatology. Specifically, we wanted to address and examine the similarities and differences in satisfaction between new dermatology patients and follow-up patients. In the past, many studies have only looked at dermatology patients altogether. However, it is important for us to realize if there are any differences in experiences between new and follow-up patients. So in this cross-sectional study, we examined patients seeking care at a dermatology clinic in the US at a major medical center in the southeastern region of the US. The participants were outpatient dermatology patients, and after the dermatology or the teledermatology visit with the provider, patients were asked if they were interested to participate in a voluntary survey about their experience using telehealth. The data collection period of the study was between May 13th and June 5th of 2020. And we had two medical students who were following up with patients, asking them to participate in the studies. The main outcome was patient satisfaction levels across visual satisfaction, audio, the quality of the video, their comfort level using the technology. And we again stratified based on new and follow-up patients. For data analysis, we used descriptive analysis. We also used t-test and one-way analysis of covariance, or ANOVA. We also used logistic regression to identify key predictors and the relationship between satisfaction and certain patient characteristics. So we had 184 completed surveys. The response rate was 64%, which is very good compared to conducting a study during a pandemic. The average age of patients was 37 years. 73% of the survey respondents were females, and the majority were Caucasian. 62% were white, 24% Black, and 7% Hispanic or Latino. Half of the survey respondents had a bachelor's degree or higher levels of education, and a little under 60% were privately insured, and 38% had public insurance. Overall, patient reported satisfaction was very high, both among inpatient and follow-up patients. As you can see in this figure, almost both were at the 95–96% satisfaction, rating their overall voice and visual quality of the visit to be either excellent, very good, or good, which we considered as positive satisfaction. Also the time characteristics, looking at two aspects of time: the length of waiting to be seen, and also the length of time with the provider, or the duration of the visit. Again, between new and follow-up patients, no major or striking differences. High satisfaction, if we look at excellent, very good, and good, we see that the ratings of poor and fair were 5% and or lower for both groups. So again, high satisfaction among both groups when it came to the wait time and the time spent talking to the provider. With regards to provider-related outcomes, our survey wanted to investigate 3 different outcomes: the treatment explanation that was provided by the treating physician, the thoroughness of the provider to be able to ask thorough details and also provide thorough plan of care moving forward, and finally the how did the patient feel from a courtesy and respect standpoint in the telehealth visit. Again, we see that high satisfaction was among both new and follow-up patients. No major differences between groups, although it seems like for new patients and follow-up, when it came to rating courtesy and respect of the provider, there were slightly better ratings, more satisfied patients on the follow-up category than in new patients. So we also wanted to look at the overall satisfaction by patient characteristics and visit characteristics. We see that there was a significant difference in patient type between new and follow-up for overall satisfaction. So this is their total assessment of the visit, not just voice or video, but everything combined together. There was a significant difference between new and follow-up patients. New patients had a higher satisfaction level than follow-up patients. When it came to the prior telehealth experience, we did not find statistical significance, whether if someone had previous telehealth experience or not. That did not have any association with satisfaction. The visit type, again, between phone and video, we really didn't see a huge difference in satisfaction, meaning that both modalities were acceptable by dermatology patients. When assessing the different telehealth platforms that were used in the study, Doximity, American Well, which are common telehealth platforms in the US and were adopted during the COVID pandemic across healthcare systems, there was no statistical significance, as in satisfaction did not change significantly between one platform or another. So in discussion, we found that there was high patient satisfaction across numerous key measures. A little over 2/3 of patients rated their experience as excellent. And the overall satisfaction of telehealth did not really change by demographics or the location of residence, meaning rural or urban, or patient education or insurance status. These, we could not find strong associations that they were strong predictors of satisfaction. New patients had statistically significant higher satisfaction ratings compared to follow-up patients. We believe that one of the reasons for follow-up patients having new patients having a higher satisfaction compared to follow-up is that follow-up patients may have something to compare. It's not their first visit with this provider, so they have a point of reference and a point of comparison to compare to, and therefore their assessment of the telehealth is comparing it to an in-person visit versus a new patient who this may be their first time interacting with the provider or even seeking dermatology care. And therefore, there might be a confounding factor between new and follow-up patients, which is their previous experiences. Future investigations should examine community barriers and challenges to using teledermatology, like broadband access and physical access to healthcare. Also understanding socioeconomic factors and how they may affect patient adoption and satisfaction. Some of the limitations of this study were that this was a single site study, and it was a convenient sample of patients that were treated by a dermatologist at this medical center. So with that, thank you very much. And if you have any questions, please feel free to reach out. This is my email and my Twitter handle if you have any questions or you would like to reach out for any comments. Thank you very much, and we hope you enjoyed the conference.